What's up, everybody, and welcome back to the podcasts. My name is Robbie Cassidy, and on this episode of the podcast, we're going to look at why your back pain treatments may be failing. And I want to try to explain the wrong problem, what a lot of people are stuck in. So this is something that's obviously come up every single week in conversations with clients. And it's people who are looking to make change, but they're getting stuck in the same cycle. And then you start to lose a bit of hope. Because it can be really hard. You feel like you're doing everything right. You feel like you're doing everything you can to heal, to be better, to improve, or just to do yourself right. But the issue is that you're running into, you're kind of focusing on the wrong thing. And I'm going to try to highlight that today. And I'm going to hopefully try to point you in the right direction of what you can do and what works for the people that we work with. To understand this, you're going to have a bit of an open mind, because it's going to be different to the way you think. It's going to probably go against a lot of the stuff that you have been told. And you have to realize that what you've been doing may not actually be what you need. And to really change the direction that you're going in, we need to do this a little bit differently. But the good news is that you're never gone too far. And if you keep faith and commit to the process, like, we can fix this. You don't have to live the life of frustration. And honestly, that's the one thing that so many clients say to us before they jump on board, is that they're just living in a place of constant frustration about their body, about their life, about the pain that they feel, about the fact that they just can't get over this constant recurring injury or constant recurring pain. Now, to get started, I suppose, looking at this broadly, like, most people get treated for what shows on a scan: the disc bulges, arthritis, degeneration. But there's so many faults to this method. And you might say to me, and I honestly get this all the time, is, Robbie, I can see what's wrong with me. It's clearly stated on the MRI that I have a degenerating disc, or bulging disc, or stenosis, and this has to be the cause. And I would say, okay, if we want to subscribe to that, if that's what we're going to tie ourselves to, then we need to have a bit more information around it. We need to ensure that this way of thinking has to be consistent. That if we have the degeneration there, if we have the bulging disc, if we have that stenosis, that must mean that in every single case that there has to be pain. It would mean that if anyone had degeneration, that they would have to have pain. If anyone had a bulging disc, they would also need to have pain. And okay, let's maybe just take a little step back here, and let's look at the research. Let's not say, what's your opinion on this, Robbie? Let's look at what the research really shows, and try to get an unbiased opinion on this. Not the opinion of the person who's going to bring you in and give you an injection, or the opinion of somebody who is going to surgically operate on you. And honestly, most consultants are very, very good people, and they're excellent doctors. And I think that they get a bit of a hit as well, in that people are always going against them and saying that this is what they do. But it's not. Unfortunately, you can only work with what you have. You know, if you go into a car mechanic and you have a plumbing problem, you're probably going to not be helped so much. They might be able to aid you, but they're not going to be able to give you this new and exciting way of doing things. In the same way as if you go into a Volkswagen dealer and you're looking for a Ford, like, you're going to get a Volkswagen. They're not going to give you a Ford because they don't have the option. So that's why I say that I don't think that inherently that any consultant is bad or any doctor is doing the wrong thing for you. But I think that sometimes your options are so limited when you go into it. So that's why we want to look at some of the outside research on it. So what does it say? Let's look at asymptomatic individuals, people who have gotten an MRI but didn't have any pain. They just got the MRI because there was research that wanted to see if there was anything would show up even if you didn't have pain. And what came back? Well, if you look at the results, 50% of people over 30 years old had a degenerating disc, and no pain at all. 1 in 3 people had a bulging disc and they had no pain at all. And the same thing with facet joint degeneration. It's the same thing with spondylolisthesis. It's the same thing with stenosis. There is a significant portion of the population who will have these results on MRI but not have any pain. So what does that mean for us? Well, it means that when there's other people who have the exact same scan as you but don't have the same symptoms, we can't directly point to the scan as being the determining factor for what we have, because it doesn't follow along the lines of the consistency that we're looking for. And if we're looking to be specific in how we approach this, we need things to, I guess, there has to be some form of a system or structure in place. And that's why I said to you before this, I said, if we're going to live by the MRI scan, and if we're going to subscribe to that way of thinking, there has to be consistency across the board. Because that means that if you're thinking this way and you're saying that this is the problem and I've tried loads of things and they haven't helped, well then this hopefully then opens your eyes to say that, okay, maybe that's not the main problem. Maybe that's just a sign that there could be other things going on. So scans don't actually predict who's going to get better. And that means that we need to start measuring our recovery differently. What could be causing the issue then? So if this isn't a physical thing, is it all in my head? The next thing that we need to address, because so many people are told that it's all in your head and are left out on a limb not knowing what to do, thinking that they're going insane. When you really think about the frustration and the anxiety, the fear that drives it can't be measured because it leaves you feeling lost. But the thing is that you don't need to go on feeling like that. You don't need to feel like you're alone and that you don't know what to do or that you're going around in circles. Because what I'm going to tell you is going to change how you approach it. And it's going to give you a bit of hope that this can stop controlling your life. But you need to open your mind to it. So if you're dealing with a pain that flares up and then it reduces, it gets worse and it improves, you might be in the mindset now that you think that, and I've heard this all the time, Robbie, it never gets better. It's always the same. It's always bad. Every day for the last 6 months, the last 2 years, I've just been in a bad place. But I'm going to highlight this very early on. You need to be careful of this mindset. Now I'm going to speak directly to the people who want to change. And I'm going to say it pretty straight because I know this is going to be tough. I understand it's taken over your life and it's very difficult to see a future. But we see if we're not aware when we ourselves are playing a role in this, it can be very hard to change it because we get into such a dark place. So when I tore my knee in a jiu-jitsu competition, I had no stability at all. I could rotate my knee out of the socket. If I was crossing the road and I jumped and I tried to land on one foot, it would slip over itself and it would completely collapse. And when I was trying to get back to training, and I actually had this conversation with the guy yesterday, I'd sit and I'd hold a little pity party for myself after a training session because it kept on re-injuring. And I would give out about everything in the world and everything all around me, and I would say how it couldn't be done and it's not worth it and I may as well just give it up. But in that moment I had to catch myself, and in fairness I was very lucky because my friends had noticed it and my father caught me with it too. Probably the only person in the world who I'd say I'd listen to, but he did call me out for it. And you know what you're doing here is you're going to sit and complain, or are you actually going to try and do something to work for it? Because with the way you're going, you're just going to stop doing all the things that you love. And that is what I want you to be aware of. First off, because no one likes to be around a negative Nelly all of the time. They're draining, they drop the mood, they sap energy. Second, it doesn't get us anywhere. it just really creates a bigger hole. And honestly, I'm not against a rant. I often see the biggest breakthroughs with clients happen after they have a big rant and they give out and they just get it all off their chest. But ranting and getting pissed off are completely different than living a life of constant sorrow. So to change, you need to make the decision to change in your mind also. If you don't even know what it looks like, I challenge you. It's a great book. It's called Mind Power by John Keogh. Very simple strategy to change your focus from negative to positive, to bring you out of a bit of darkness, to give you a different way of looking at things. Because a lot of people don't realize that many of the thoughts going through your mind at any stage are in some way adaptable and controllable, and you can manage them. But if you let them run free and you are constantly having negative experiences, you'll see that will flood your thoughts. So I would challenge you to read that book. I'm not saying you need to live by it, but it'll give you an alternate perspective on how you can approach this. Because when you are so deep in that negative cycle and become very defensive, it's often good to have someone speak openly, where it's not directly at you. And I think that's why the podcast is such a big thing, because a lot of people who jump on board with us come through the podcast. And I can highlight things here and I can talk openly about it. And obviously, this isn't directly I'm not speaking about your case specifically, but if it resonates, if you're getting pissed off, if you're getting annoyed at what I'm saying, there's a good chance that some of it is connected to the way you're living right now. And that's okay, because realistically, I'm going to be on your side. But if it helps to change your mind on what needs work, then I'm going to be happy. So to get back to the point, if your pain is flaring and it's improving, we're going to have to look at nervous system involvement. It doesn't make sense otherwise, because if you sprain an ankle, it doesn't flare up and then it improves and then it gets sore and then it improves again. It hurts every single time until the ligament heals. And when we know it's about how the nervous system reacts, then it's time to start addressing it. And that is exactly why when you went to your physio or your chiro or your osteo, or you got your injections or you got your massages, that you only had this short-term 24 to 48 hour relief. Because the focus is primarily on the muscles. It's on your posture, it's on your hips being offline, it's on your MRI results and your discs. But it never really addresses the underlying issue. So let's look at this again from an unbiased position. And let's look at the Restore trial. Came out this year. The Restore trial found that recovery depends on changing how your nervous system actually sees movement versus fixing a structure. And so they basically did a 3-year study. They found out that you can have much more significant change in pain by working on movement confidence versus movement correction. And I've worked in a gym for years, different stages. And I used to always say to the coaches, be very careful about saying to somebody, watch your back. Because the more that you emphasize watch your back and you need to have perfect movement, the more you can create fear avoidance behaviors. And the more that people have attached to this identity that their back is fragile or they have these fear avoidance behaviors, then the bigger a problem it is. So the thing is that with this research, you're basically telling people that it's key to start looking at fluidity, motor imagery, versus just telling someone exactly how to move or their posture. And they could, because they found that when you start correcting their movement and saying this is exactly what you should do and you should sit in a specific posture, it doesn't give you a long-term benefit because of all the associated behaviors. But actually getting them to move more confidently and getting them back into activities that they love and getting them back into enjoying their day-to-day has more of an improvement on obviously quality of life, but then it drops pain levels. And that's what we're here for, is we want to stop having pain controlling our lives. So how can you start to implement this today yourself? Well, firstly, you need to start working on the story and the image in your head. If you're going to continue living by your MRI results, and if you're going to continue thinking that there's always a structural basis to your pain, then you're going to keep running into the same problems over and over again. So the first challenge for you this week is to start thinking about it differently. And then we can reframe it. So you need to start working on the story and the image in your mind. And that may mean you need to understand your pain pattern a little bit better. And then when you do, you can start to implement a technique that uses motor imagery. And it literally means having a better image in your head of how you move, how you bend down and pick something up, how you walk, how you climb, how you run, how you do any activity in the gym. You need to replace the image of you being careful and safe and restricted and blocky. And that might not be a conscious thing right now. You might not even realize that that's what you're doing. But we need to replace it. We need to become conscious of it, and then we need to change it. And what we need to change it with is us and an image of us moving through activities, sports, just everyday normal stuff with ease, with intention, and with fluidity, where it's fun, it's playful, and you're actually enjoying activities versus when you think, okay, I want to do that, I want to go for a walk, or I want to go to the gym, or I want to maybe play tennis or play paddle or go play golf, and you freeze and you find that everything locks up a small bit. We need to break that, and that's rule number 1. If you don't break that, it's going to be much more challenging to make a long-term improvement. So right now you have to think that the nervous system map is extremely protective, and we need to change this. And honestly, from the research, a very simple way of starting that you can do that today if you're sitting in the car listening to this, or if you're at home, is that I want you to just start to think of what you would look like, or how would you act if you didn't have back pain? How would you act if you were fit, healthy, strong, moved like an athlete? Like, what would you be doing different? And the next thing is actually start doing that. Try to do it. Try to move through your day normally. Remove that fear. Remove that blockish, hesitant, fearful movement. Remove the overthinking where you do something, you feel it, and then you start thinking for the rest of the day, oh my God. Like, I had a great conversation with a client yesterday who had a bit of a breakthrough where he had been constantly, he'd get a little bit of a nick, and then he would keep thinking, what's that going to be like? What's that going to be like? Is it going to get worse? Oh my God, I need to be careful. I need to watch this. I'll take the next day off training. And we had a really good conversation. In fairness, this guy is open to change, and he's open to trying new things. And in the conversation, we just said to him, look, man, next time that happens, instead of constantly checking in on it, let's just go about our day. Let's try to change it, rephrase how we reframe, I should say, how we speak about it, and talk to ourselves and say, that's actually okay. It's just a reaction of the body. I'm going to be okay. And he did it. Going through normal workout, a little bit of a catch in the back, which is okay, which is normal. Everyone gets it, whether you have a back issue or not. And started to ramp up. He was able to reframe. He was able to come back. He was able to understand it. And he started making the change. And as the day went on, lo and behold, the pain didn't increase. And he didn't go into this flare cycle. Now, that's going to take work. That's only one part of it. And as he said, it was a big battle to do that, because we have to think that to change how we speak, to change how we talk, to learn a new skill, you're going to have a little bit of a battle. So I guess to get a better understanding of this, it's going to be really important that there are 5 different patterns. And if you look at these patterns, it'll help to identify and classify some of the pain that you're feeling, and then it will give you a very specific way to deal with it. But it's important first that you understand your pattern, because if you're kind of just shooting and you're saying that, okay, it's a bulging disc, so I have no chance, or it's a degenerative disease, I have no, like, that's the way it is, it's only going to get worse, I can guarantee you that it will get worse. But the 5 patterns that we have found within our clients is a deconditioning or a lost strength, an increase in sensitivity, an overload, a load management, or a nervous system pattern. And if you want to find out which one is you, all you have to do is click the link or type in painbacktoexercise.com, and it's there for free. You can go in, you can take the quiz all the way through it. It's about 12 questions, and it will show you then which one it could be you. And if you understand it, watch the video. It'll give you a very short roadmap about how to get back. And honestly, it's been so effective in helping people to classify it, because then they stop thinking that, okay, this is purely a bulging disc based injury. This is a nervous system sensitivity, because it looks at your experiences and it looks at your confidence levels and it looks at the type of flare-ups that you have. It looks at the type of pain that you have. But you need to be honest in answering the questions. You can't just go in and say, this is what I think it is. It's like, actually have a proper sit down when the questions are there, go through them at your own pace, and as best as you can. It's about not catastrophizing, not making it out to be the worst thing possible, and being realistic if you want to get a proper pattern. So check it out. I'll put the link in the description of this podcast. It's completely free. It honestly takes about 2 minutes, I think is what it is, to go through it. It doesn't really take 2 minutes, but we say 2 minutes. It takes about 60 seconds if you just fly through it. But I would prefer if you did take the 2 minutes to go through it, because at least you can think about it a bit more and it'll help you to understand it. So to go back to the key at the start, why your back pain treatment keeps failing, and the wrong problem. The wrong problem is that you are looking at it from a biomedical perspective, and that's causing you to look at MRI scans and to treat your symptoms and to frame your back pain a certain way. And you frame it as, my discs are crushed, or they're dried out, or one of them has degenerated, or my facet joints are gone, or it's bone on bone, or my disc has slipped. Discs don't slip, just to let you know. But it's just a phrase that we use. Or that somebody can put your disc back in place. And you've probably been told that before as well. That's an absolute lie. Or your hips are offline. All of these are mechanical bases to pain. And as we know, 95% of non-specific low back pain has no physical cause. That's the research. That's not me just throwing out that stat. That's what it says. So if we know that, then we need to look at other factors that are driving it. And the MRI can help you to understand it. And you may have symptoms of a bulging disc. But if you're getting the same issue for years and years and years, we have to approach it different. I had 2 bulging discs in my neck. I know what it's like. I know when you go back to the side, it shoots down your arms, you get numbness and tingling, gets very irritated. When it gets really irritated, it locks up. You can't move, you can't turn left and right. You can do nothing. I know that because I've been through it. But there's a massive sensitivity aspect to that. And the sensitivity aspect is the reaction of the body, where it locks everything up and you can't turn your head. You can't bring your chin to your chest. You can't look behind you. That's the sensitivity. You can actually calm that down, because the disc is only really exposed in a very specific position. So we need to address that. We're doing really good work with people who are dealing with bulging discs and who want to avoid surgery. That sounds like you. Take the back pain diagnostic. So go to backtoexercise.com. Go all the way through, get your pattern, book in a call, and we can go from there. But that's the issue. That's why your back pain treatment keeps failing, is you are going after a mechanical issue when it's a nervous system sensitivity or nervous system involvement. And the more we start to address the nervous system, the better we get back confidence. And this is what actually works. That is why generic physio exercises fail, because they treat everybody with the exact same thing. Crack your back, get a massage, get dry needling, get your injection, do your bird dogs, do your cat cows, do a couple of glute bridges, hope that everything calms down. In 6 weeks, you'll feel better. You won't have any confidence. You'll still have a lot of fear. This is the common theme that people who jump on board with us are dealing with. And what actually works is you build movement confidence, you grade your exposure, you improve your tolerance, and then you understand that not every pain is equal to damage, and you need to reframe the way you think about it. Because if you think that everything is a extremely damaging issue, if every pain is causing damage, I can guarantee you that it's going to hinder your recovery, and it's going to send you down roads of surgery that you don't actually need. But that's all I want to chat about today, and I appreciate you listening in. I do know that I missed a couple of weeks of the podcast, but I will get back again on track, and I'm flying back to Ireland this week. I recorded this podcast in Bali, in Indonesia, and it's been a long time coming because I've been planning it and going back through it and kind of had it there in the background because I wanted to make sure that everything was covered, and I wanted to make sure that I could give you a very specific tool that you could work with to help you to understand this better. So hit the link in the bio. As I said, it's free. You don't need to give your email or anything. When you go through it, if you're looking for a role plan, it will ask you for your email. And then when you put in your email, then it'll say, do you want to jump on a call? And honestly, if you're sick of living this way, if you're frustrated and you're going to be going into the summer and there's really no positive, why not just jump on a call? We can talk through it. At the end of the call, I can talk through the type of work that we do, the type of programs that we have. And if it's a fit and we think that you're a good fit for us, then I will look to see if we have space for you. And if it's not a good fit, I'll just tell you, and I can tell you you can try a few of these things and move on. I've done that a lot recently. So I look forward to chatting to you. I do hope this helped. And oh yeah, last thing, if it did help, I would love if you could send it on to a friend, because the word of mouth is the best way that we can promote the podcast versus running ads or doing anything like that to it. Word of mouth works the best because if you've been dealing with it, if you've improved off it, then if you can help someone else, that would be great. And yeah, otherwise, I'd love if you could give us 5 stars as a rating. That goes a long way as well. But that's all for now. I won't keep going. I hope it helps. If you need anything, reach out, info@themobilitytutor.com, or you can reach me on Instagram at @RobbieCassidy_ and LinkedIn at Robbie Cassidy. That is all. Chat to you very soon. Ciao, ciao. And I'll see you all at the same time next week. Have a good one.